Hello, my name is Angel Moss Baker, and I am excited to guide you through a well-structured program that highlights the essential steps to effective treatment and positive outcomes for Black men with prostate cancer. First, I invite you to imagine sitting in your doctor's office, waiting to receive test results. Suddenly, the doctor says the words that change everything. You have prostate cancer. In that moment, time seems to slow down. The room falls quiet, but inside, your mind is racing with questions. Will I survive this? What will happen to my body? How will I tell my family? Will I still feel like myself? Now, picture leaving the doctor's office with a folder full of medical information, but without a clear path forward. No one has fully explained what this diagnosis means for your future, your relationships, your faith, your finances, or your identity. You're expected to be strong and make quick decisions while grappling with fears that may, not feel safe enough for you to express at that time. So, the purpose of this presentation is to introduce a culturally responsive cancer care approach designed specifically for Black men who have been newly diagnosed with prostate cancer. Current national cancer data shows that prostate cancer remains one of the most common cancers among men, with substantially higher incidence among Black men. Black men are often diagnosed at later stages, leading to more aggressive treatments and increased morbidity and mortality rates compared to other racial groups. Factors contributing to this disparity include institutional racism, limited access to quality care, mistrust of the healthcare system, and socioeconomic barriers. When a population faces a higher incidence and more than twice the risk of death from prostate cancer compared to other racial groups, a culturally responsive treatment protocol is essential to address this health disparity. For these reasons, the red carpet entry group protocol for Black men is not only justified, it is also necessary. So, introducing to you the red carpet group protocol, improving prostate cancer outcomes for Black men. This program is designed for implementation in primary care settings, specialty care settings, and of course, integrated care settings to help Black men move through diagnosis to engagement, from fear to informed action, and from isolation to supported survivorship. The Red Carpet Protocol is a 6-session intervention that is culturally responsive and adapted from the Red Carpet Entry HIV linkage to care model in Washington, D.C. It enhances the quadruple aim framework by improving patient experience, reducing costs, and offering a clearer structure for addressing patients' complex needs. This is achieved through a structured intake process that utilizes the 5 A's: assess, advise, agree, assist, and arrange. The program aims to provide rapid linkage and access to cancer care, increase health literacy, support informed decision making, address behavioral health and quality of care concerns, and improve treatment outcomes. The 6 psychoeducation sessions cover key areas for Black men facing prostate cancer. It includes building trust, understanding the disease and their treatment options, managing urinary and bowel issues, addressing sexual health, supporting mental health, and self-management, recovery, and survivorship. Now, this slide outlines the key implementation steps for the red carpet entry process. We first have the diagnosis is confirmed. Once the diagnosis is confirmed, the patient is referred to the red carpet group protocol. Referrals can come in 3 ways: by the primary care physician, by an oncology clinic, or even the patient himself can self-refer. The next step is to get the consultation or intake done. So, a behavioral health specialist on that same day that the person is diagnosed, they receive that diagnosis, or within 48 hours, This can occur in person or virtually. They have an intake done. A clinical consultation is completed. The consultation, of course, like I mentioned, we're using the 5 A's. After the consultation and intake is completed, the person will move into step 4, where they begin to engage in the group process. This takes place within 72 hours of the diagnosis. This also includes, the 6 sessions also includes 6 months of follow-up and check-ins with the patient. This is so that we can maximize the potential for positive outcomes and support the patient's journey toward recovery. We finally have step 5, which is tracking. This is where we are monitoring treatment outcomes. We're tracking the results of cancer treatments and evaluating the effectiveness of the red carpet entry group protocol. Now, prostate cancer affects more than the prostate. In addition to significant distress related to the diagnosis and treatment, patients often experience emotional and mental conditions related to their illness, such as anxiety, depression, grief, trauma responses, sleep disturbance, alcohol, and substance use. So embedding a behavioral health specialist on the medical and oncology team is essential to this model and to delivering integrated person-centered whole person care. A behavioral health specialist can help normalize the emotional and behavioral reactions by providing timely assessments and culturally responsive behavioral interventions. In an integrated care setting, the behavioral health specialist does not replace medical treatment. Rather, they help make medical treatment more accessible, person-centered, understandable, and sustainable. They can enhance care coordination and contribute to a patient-centered and compassionate patient experience. So I ask you to consider this protocol. Black men who are newly diagnosed with prostate cancer require this structured path from diagnosis to survivorship. The red carpet entry group protocol addresses this need by bridging the gap to timely access to culturally responsive cancer care. It also aligns with the quadruple aim framework, so we can create a more efficient healthcare system that benefits both patients and the healthcare providers. The following budget categories outline the essential resources needed to implement a 6-month pilot of the red carpet entry group protocol. This investment is designed to enhance direct patient care and engagement, ensure that patients remain connected to their care from diagnosis through survivorship. The recommended option is the medium cost choice, which is highlighted in blue. This option offers the most effective and feasible path forward, supporting staffing, navigation, culturally responsive materials, data tracking, and sustainability planning. So I want you to take a look at this, consider it, and I want to thank you for your attention. And I am very confident that our collaboration will lead to excellent results. So I look forward to your response, and I'm excited about what we can achieve together. Thank you.